As someone who has worked as a nurse and midwife for over 3 years, there are so many things that I've seen happen during labor, and I feel that a lot of pregnant women do not know the truth or facts about certain things before they fall into labor. And this ignorance sometimes make them make decisions that may not be beneficial for them, for their baby, and later on. That is why I'm making this video, to share so many things that pregnant women may not know before they fall into labor. Hi guys, my name is Busabi Moliayo. I am a registered nurse, I'm a registered midwife, I am a Nigerian, and currently I live in Scotland, United Kingdom. On this channel, I film content about nursing and healthcare, so if you're interested in that, please click on the subscribe button to join the YouTube family, and also on the bell icon so you get notified whenever I drop another amazing video. Now, I am a young nurse. I know you're probably looking at me like, who is this small girl that wants to talk about pregnancy? Yes, I'm quite young, but I've spent a good amount of my years as a nurse working in the hospital, and a good amount of time I've also spent working in the maternity O&G department. I have taken a lot of deliveries. I have been in the theater, watched some cesarean sections, and also worked with nurses who are resuscitating babies after cesarean section. So believe me, everything I want to say in this video is not based off of things I read on Google. They are based off of the knowledge that I attained when I was in my midwifery training and when I practiced as a midwife. So please, I know what I'm about to say. So the first thing I'm going to talk about is episiotomy. One thing I've noticed that pregnant women, when they fall into labor and you try to explain to them that yes, the labor is progressing, there might be a need for them to have an episiotomy done, they go all out and say, oh, is it going to be painful? Why will you do that? I don't want that. And some of their husbands also start saying things like, oh, why will you do that to my wife? Why do you want to cut my wife's vagina? What's that? Why will you do that? Like, at first instance, they don't want to agree. And I realize it's because a lot of them do not really know what an episiotomy is. So for context, episiotomy is a medical procedure actually that involves using a special scissors, which is the episiotomy scissors, to make an incision on the vagina of a woman during labor to allow to give more space to the head of the baby. Like, that is a very, very simple layman definition of what episiotomy is. So when we tell these women that, okay, because it happens a lot if it is a fresh pregnancy where the walls of the vagina are still very rigid and tight, and the walls of the perineum, like the perineal muscles, are still like very, very rigid. And when the baby, like the estimated size of the baby's head may be a bit too big for the vaginal wall to stretch enough to accommodate it. And most of the time you would not really know if you need an episiotomy until like the baby's head is about to come at you, and when you judge, you'll be like, okay, this woman is going to need an episiotomy. It's not every time that it's done. It's not compulsory. It's not going to be done for every woman. It's only done when it is necessary. But when we try to tell these women that you may have an episiotomy done, they kick against it. And the husbands believe that, oh, my wife's vagina is going to be larger than it used to be. And no. We are not in any way trying to be wicked or mean or trying to like just pour your intimacy life. No, we're just trying to save the baby. We want enough space. And after this is done, it will be sutured back with a special method. Okay, we're going to do the suturing back, and it will heal up after a couple of weeks, and you'll be fine. You'll be fine. So women should be aware that episiotomy is a normal thing. It is not like if you have an episiotomy done, you're an abnormal woman, or you could not push well, or you could not push out your baby, or maybe your baby's head is too big. No, it is something done to save the baby, because we don't want the baby to go into asphyxia. We don't want the baby to stay too long in the second stage. Like, we don't want the head of the baby to stay too long there. We need the baby to come out fast, and we can continue with the rest of the labor, so both the mother and the baby are fine. All right, so that's that by episiotomy. No nurse is trying to like spoil your intimacy life with your husband or with your man. Okay, the second thing that I've noticed that a lot of pregnant women tend to do when they are in labor is that once they notice that the labor has started and you've confirmed, okay, ma, you are in labor, they want to start walking around the hospital. They want to start moving up and down. Some of them say, oh, they want to go home. Oh, my grandmother, she said when she was in labor, she was pounding yam, and after she finished pounding the yam, that was when she gave birth. I've noticed that happening. And some of them will be like, oh, I want to walk up and down. I want to climb the stairs so that my labor will be fast. First things first, labor is not supposed to be fast. Okay, if your labor starts and in next 3 to 4 hours you have given birth, that is called like a precipitated labor. That is too fast. So some of you that say, okay, I want to take this, I want to take that, I want to take this medication, I want to take that medication, I want to take this herb, I want to take this juice, this drink to make my labor fast, you're doing yourself more harm than good. Ideally, labor is going to be taking like 6 8 hours. I'm not even talking about the active phase now. I'm not talking about the latent phase from the beginning to the end of the labor, which could be like 12 10 11 hours, depending. It has individual differences anyway, but you have the active phase between like 6 to 8 hours is still a normal time. But if you're having 3 4 hours, 3 hours, 2 hours, that's not nice. So that is one. Labor is not supposed to be fast. So don't even try to like rush it. It's not normal. Then when they say they want to walk up and down, you can actually harm your baby by doing that, because you're putting yourself at risk of something called the cord prolapse or cord presentation. Those are two different things anyway. What happens is that the umbilical cord, by the time you're moving around trying to just turn everything, like you're not staying in a place, you're not resting, the cord may slip and come in front of the presenting part of the baby, which is usually the head. So you have the cord coming out before the head of the baby, and that is very very dangerous. If you already have the amniotic sac leaking, like you have amniotic fluid leaking already and you want to move around, you may end up draining a lot of amniotic fluid that is supposed to keep the baby, that the baby needs, and you're discharging all of that because you're trying to move up and down. Moving up and down, it doesn't help during labor. Okay, another thing I found out that a lot of pregnant women may not really know about when they come to the hospital for delivery is that they are not aware that there's something actually called forced labor. Some of them will feel that, oh, I am in labor, I can feel the contraction, but they are called Braxton Hicks contractions and they are fake. It is not as if you're in labor. So this Braxton Hicks contraction, most times they come before the real labor actually starts. Like maybe a month, 2 months before the real labor actually starts, they start feeling this Braxton Hicks contraction. So when we assess them and we check for all signs of labor and we don't see signs of labor, and we tell her, you're not in labor, ma'am, some of them flare up. I'm in labor. I can't feel the contraction. I can't. It is always funny when you're trying to explain to pregnant women that the contraction you're having are false labor contractions, not the actual contractions that you need to push the baby out. So a lot of them get offended, they get annoyed, and they leave. And I think it's because they don't know that things like that existed. Like if they're aware that there's something called forced labor, if you now tell them that they're having a forced labor, I don't think that they will feel offended about that. The next thing I'm going to talk about is this breaking of the water bag. Now, a lot of women feel that once the water bag breaks, that means they're in labor. Yes, breaking of the bag of waters is also one of the things that happens during labor, but it may also happen too early and may put your baby at risk. Yeah, it's not only when you see a splash of water that the water bags are breaking. If you start draining consistently as a pregnant woman and you know that this is not urine, this is not your normal vaginal discharge, you're seeing that you're draining water, please pack your bags and go to the hospital. Especially when it is not time for labor, you'll be like, oh, my water bag cannot break. It will only break when I'm in labor, and probably you're in your 6th or 7th month. Please go to the hospital. Go to the hospital. I've seen a couple of situations where the women come to the hospital after they have drained for days, and there may not even be any more activity of the fetus. The fetus may have been gone before they even presented. Like the daughter would have drained and drained and drained and drained and drained and drained and drained. So please, whenever you find yourself draining, it's not urine, it's not your normal vaginal discharge, please come to the hospital. Don't let that movie of, okay, it's only when you're in labor that your water bag is going to break. If you're draining when it's not time for labor, there's no problem. No, there's a lot of problem. Please come to the hospital for that. The next one is actually very funny. I've seen a lot of situations where women would come to the hospital, and before you get their folders or access their medical records, you start asking them questions like, what is your gestational age? And they cannot tell you. Come on. Now, if you're in an emergency situation and you can't tell us exactly, like some people be like, okay, you guys should be able to judge as midwives or as nurses, you should be able to judge my weeks of pregnancy just by looking at the size of my tummy, but it doesn't always work like that. Yes, there are ways that we can check the gestational age by measuring the siphsophoidal height, but most of the time, sometimes it's not always accurate, especially when the baby's size is small, or probably the mother has a large tummy on a normal day. There are variations that could occur. So it is always important as a pregnant woman that you know your gestational week offered. So once you get to the hospital, before they even start looking for your card, looking for your files, or trying to assess your medical records, you can easily say them, okay, this is my weeks and these are the symptoms that I'm feeling. And if you're not supposed to be feeling that signs, you're not supposed to be having those signs or those symptoms at that week. Everybody can get into action quickly before you even bring out your medical record. We can start doing some first aid and some emergency treatments to save you and your baby. Knowing your gestational week of pregnancy is as important as saving your life and saving the life of your baby, because by the time you're still there trying to ramble, oh, I got pregnant here and this is my LMP, we're still trying to do calculation, you might actually be in danger. But if you had told us immediately you got there, this is what I'm feeling, this is my gestational week, everybody knows that, okay, this is not normal, and we can swing into action immediately. Help us to help you pregnant mothers, please. Another thing is that a lot of pregnant women do not know that there is something called TENS and epidural. It is possible for you to have a vaginal delivery without feeling pain or with little pain. Yes, these services are not very popular. I've not actually used one myself, to be honest. I have not had to conduct a delivery for a pregnant woman with the use of TENS and epidural, but it does exist. There are hospitals that actually have these services, and it is nice if you try to like look out for them. And yes, they are pricey. They are pricey, but if you can afford it, why not? You don't really have to go to the pain. As long as they are trained professionals there and they done what they're supposed to do, you can have a painless spontaneous vaginal delivery. When I tell people about this, people think no, it's not possible. Can't have a vaginal delivery without pain, but it is actually possible. And I feel a lot of pregnant women are not aware about this, and they have a right to know that this service is available no matter what, no matter if it is even scarce or pricey. If they want it, if they can afford it, they should know that things that like options like that actually exist, and they should be able to access that. That is my personal belief, and that's why I'm sharing it on this video. Next thing I'm going to talk about is the reason for cesarean sections. Oh my god! Now, where I come from in Nigeria, a lot of us are very religious. So once they tell pregnant women things like, oh ma, you may have to go for a cesarean section, they begin to rebuke it, they begin to pray against it, they begin to cry, they feel so bad, they feel like they've done something that they were not supposed to do, or one village people is after them, or they just start to make all forms of superstitions, and they start saying all sorts of things whenever you tell them they have to have a cesarean section. But people should understand that telling you to go to have a cesarean section does not make you less of a mother, does not make your child less of a human. It means that it is necessary to save either the life of the mother, the life of the baby, or both in some cases. Yeah, there are situations whereby it is both the life of the mother and the baby that are at stake if we allow them to continue a spontaneous vaginal delivery. So what you should do in this kind of situation is ask, okay, why do you want me to go through a cesarean section? And they try to tell you probably there's a cephalopelvic disproportion. The baby's presentation is probably the baby is lying transverse in the belly, which is obviously impossible for the mother to give birth. And when I say the baby is lying transverse, it means the baby is lying sideways instead of the head pointing towards the vaginal canal. And there is no way. Of course, there are options of external cephalic version where they can turn the baby, but it is not always successful. And it is, in fact, sometimes a lot of medical professionals will not even advise you to go through that route because of some certain risks associated with it. And even if you're going to do an external cephalic version, you need to have like equipment for cesarean section available on ground in case it fails. So at the end of the day, it's still like, I'm not going to say it's pointless, but I think it's still best if you go for a cesarean section. And there are situations whereby the mother is probably going into a cardiac arrest, or the mother's blood pressure is too high. That is preeclampsia. The mother is at risk of going into eclampsia. Now, in that situation, this is both the life of the mother and the baby that is at risk. Because if the mother goes into eclamptic phase, which is where she begins to have seizures because her blood pressure is too high and not controlled, we could lose both the mother and the baby. So what's the point of trying to put yourself through that stress when you have an option called cesarean section? Do you understand? So I feel pregnant women should be made aware right from the antenatal screenings that you may deliver your baby through the vagina or via CS. Both are methods of delivery, and there is going to be a reason why you have to either switch from SVD to cesarean section. Probably you wanted to have an elective cesarean section, you just wanted it, and you fall into labor. Dilatation is like probably 9 to 10, conditions are favorable, and you may want to consider having a spontaneous vaginal delivery. Like, it's really not that deep. It's really not that deep. Nobody is trying to make money off you, except when they cannot explain to you why you must have a cesarean section. That is when you should probably be flaring up and trying to see probably somebody is trying to like gaslight you or something. But if there's a clear explanation as to why you're supposed to have a cesarean section, please go for it. Don't let anybody deceive you. Don't let anybody say, okay, it's not because that doctor, because they'll start telling you, says that, oh, maybe it's the midwives that don't know their job, or it's the doctor that doesn't know their job, or they don't have enough experience. No, it's not like that. And they'll start saying, okay, let's go to this hospital, and this hospital that's been existing for 25 years, for 40 years, they have more doctors, they have more this. You will get there and they'll still tell you the same thing. They will still tell you the same thing. So the time that you have wasted moving from one hospital to another, trying to register with that hospital, getting a folder, getting this, getting that, you're probably putting the mother, the baby, or both at risk. So cesarean section is not that deep. It's really not that deep. I have had several cases, like I have witnessed several scenarios where we tell pregnant women you have to go to cesarean section, and the friend will look at me and say, are you not a woman? Why are you telling me I'll have cesarean section? Are you cussing me? You will get pregnant one day. Like literally cussing me out just because I'm just trying to help you. It's always a funny situation in the hospital, and people tend to think that we are being mean, but we are not. We're just trying to save your life. Okay. The final thing I'm going to say is people who actually start taking herbs because they are pregnant so that their labor is going to be smooth. If you're taking herbs, you might be harming your baby. Let me explain. I am from Nigeria. I grew up in Nigeria, so we literally, some of us are literally force-fed with herbs by our mothers. Yeah, I'm not going to deny that. We have at one point or the other, a lot of us have had to take herbs and all of that. But the problem with these things is that you don't know if they're teratogenic or not. By teratogenic, I mean you don't know if they can cross the placental border and go and affect the baby. And it's if you take herbs that are actually teratogenic, they may impede the development of your baby. They may impede the normal progress of the pregnancy, and they could harm you as the mother as well. Because when you're pregnant, there are a lot of hormones that are active in your body that on a normal day, on a regular day, they are not. So in that situation, if you take herbs and it goes to the wrong route, yeah, I don't want to say bad words, but you should be careful about what you take. You should know that whenever you're going to take anything for the sake of the pregnancy, it should be prescribed by a trained professional, and they should be able to give you a rationale. There should be a reason. Stop saying I want to take this medication so that my labor will be fast. You should be more concerned about the welfare or the health status of your baby and your health rather than the duration of the labor. Because at the end of the day, I already said the labor is not meant to be a quick thing. It is not meant to be a quick thing. And the level of pain you're going to feel during labor differs. In fact, aside from the fact that woman A and woman B would have different pain levels that they'll feel during pregnancy, pregnancy A of you and your pregnancy B will have, like, it's going to be two different things. Like, no pregnancy is the same. The fact that you felt a lot of pain when you were delivering baby A does not mean that you feel a lot of pain when you're delivering baby B. So it's different. Every pregnancy is different. So there's no way you're going to say, okay, I want to take this herb so that my delivery is going to be fast. You get? So this is some of the things that I have witnessed of that a lot of pregnant women have problems understanding. I won't say comprehending, but they are probably not knowledgeable about these things. They don't know about them, or they just don't understand it the way we would understand it. And I felt I should put this out there to my coming mothers, pregnant women, people who want to bear children in the future. Make enough research, ask questions, and I'll see you in my next video. Bye.